You lie on your back with your head right here. The technique that we use today is called Webster's Technique. That's what I used with your friends when they came in, and it is pretty effective for flipping babies. It's not that crazy invasive or anything like that, but if you can come close and kind of see how her belly is just kind of off-centered, just a touch. That. Oh yeah. And so there's two in here. So I'm just going to feel around and feel the little ones. And you're not finding out the genders of either one, correct?
Correct.
Okay, we didn't find out with ours either. I think it's a lot more fun. There's very few good surprises in life, and you might as well enjoy the ones that you get, right?
Yes.
Now, did you find out with any of your other ones or no?
We only found out with our fourth.
That's what I thought you said.
And that was our only girl. The rest was.
So. Alright, I'm just kind of feeling around. They seem to be asleep right now, and that's okay. I'm sure you're going to feel them move a bit afterwards. I'm going to just going to bring both knees up and kind of see how they're uneven to start. And some of that's just because of where the belly gets and everything else. You can kind of see that their pelvis is just kind of twisted because this knee's a little higher, but doesn't go up as high that way. Or anything like that. And so what we're going to do is we're going to bring this leg out and kind of work through here on the ligaments and on the muscles. You okay?
Yes.
Am I too? Okay. If I get too strong or anything like that, just tell me. Okay. It's not going to hurt my feelings. I can handle it. But tender there, correct?
Correct.
Okay. Your adductors, the muscles in there in which I'm working, they compensate for a lot of the pelvic floor, and so a lot of times we do this to help. You can see how you just kind of want to rotate out that way a little bit more. You know, the babies just kind of want to fall that way. And that's okay. They may stay a little off-centered the whole time. Like I said, some babies hang out on the left, some babies hang out on the right. When they do the ultrasound this time, ask them where the placenta is.
Okay.
I believe it's up here, but I'm just curious because I don't have an ultrasound where exactly they believe that it is.
Okay.
Okay, we're just going to stretch you for a second. You okay?
Mm-hmm.
You okay? You feel that stretch, don't you?
Yes.
All right. Am I too strong? You tell me to back off. Just check the legs. So this one's showing a little short, so we're just going to kind of pull it a touch, right? Good. You okay?
Yes.
Good. Okay. And I'm going to adjust the lid back a little bit. Cross your arms. Breathe in and all the way out. Another example of bellies that stay uncentered are ones with moms with scoliosis. They're almost always, their belly stays off center. Can you come around here and kind of show how even just that one, the stretching, working the pelvis and everything else, how all of a sudden the babies are starting to look more centered and everything else. It's quite a significant difference. That's why I wanted to point that out. What you're going to do now is you're going to lie on your side facing me. Just relax, right? Good. Just that small little adjustment and roll to the other side. Now you got a lot more cracking or popping or whatever you want to say on your first adjustment, and that's totally fine. Mm-hmm. And I believe that was your first adjustment by any chiropractor, correct? Like you hadn't seen a chiropractor ever, is that what you told me? Or no, did I have that wrong?
Just one time. That was it.
Okay.
Years ago.
Okay. Just relax, right? There, nice and easy. Good. And line your back for me. Pull that leg just another time. We're going to adjust the neck for a second. Mm-hmm. That would shift it off a little bit because I was working on your pelvis. right? Good. Not everybody that does Websters does all the stretching and everything else. I have found in 11 years of doing Websters that the response is much better. If you work the whole body as opposed to just coming in and making a couple little adjustments and just relying solely on that if you do a little bit of the muscle work, the body relaxes, it accepts the adjustment better, as well as it's much more comfortable for the mom. I didn't say while I was doing it, but because I'm sure that's tender a little bit, right?
Yeah.
Yeah, if it's too much, you can tell me to back off, that's okay.
Okay.
I'm still kind of learning your threshold of what you can handle. And everybody's different. Some people, I'm giving them everything I got, and they're like, you can go a little harder. Some people, you're barely touching them, and you're like that's enough. And either's fine, you know, like I just got to know where that limit is so that I can do the right amount of therapeutic pressure. You okay through here?
Yeah.
It's just going to adjust the front of the pelvis.
Okay.
So, again, it's an activator. I'm just going to come in here on the front of the pelvis and just kind of tender, right? Okay. I didn't think it wouldn't be. I always thought it would. I would say that's one of the more easier and comfortable adjustments that I'll do, period. You can come on up and tell me how everything feels.
A lot better.
Right?
Yeah.
A lot looser, a lot better.
Yes.
And if you look at the camera, you can see that the babies are a lot more centered now. They're not hanging off to the left nearly as much. Your belly button probably feels like it's more in the center.
Yes.
Whereas when you first came to me, you were like, it feels like it's over here kind of thing. And that's okay, you know. We're getting the kids to move. So what I'm gonna have you do is just breathe in real deep. You're gonna let it all the way out. Put a little impulse right there. Good. Breathe in again, and all the way out. Good. You're gonna lie on your side, facing me. I'm over here on this side. Alright, we're gonna lift that headrest right there. Okay, perfect. We're gonna bring this leg up. I'm just gonna lower you down a little bit. Now this is your second pregnancy, correct?
Yes.
Breathe in, and all the way out. Good. We'll tell the other side. Did you get chiropractic treatment in the first pregnancy or not?
I did not.
Okay. I'm gonna tease you and say, do you wish you had now?
I do, yeah.
Bring this one up. Good. Just relax right here, nice and easy. Good. And line your back for me. I'm gonna go ahead and touch your belly. Is that okay?
Yes.
Perfect. Just checking position of the baby and all. And we're gonna kind of work through here a little bit. Sometimes the ligaments down here get tight just with everything growing and get uncomfortable, which can either be uncomfortable in the front or can cause you to tilt your pelvis and cause pain in the back. So you can feel that side's a little tighter than the other side. And that's why I kind of do just a little bit of massage this way and so forth. We're going to stretch your leg just a little bit. Good. We're going to check the adductors. Is it okay if I put your hand down here? Good. We're going to block your adductors right in here. They help compensate for the pelvic floor. Good. We're going to check the other side. Tender or no?
Yeah, that one's more tender than the
Yeah.
other side.
Tends to be a little bit for the way that your pelvis wants to rotate and such. And that's what I'm fighting. I'm just going to pull this leg a little bit right here, nice and easy. Good. You okay?
Yeah, that felt great.
Good. You just arms flung in the air, so just making sure. I won't pull you off the table, I promise. feet up. Wonderful. All right, how's that feel?
Good.
Good. There's activator methods, protocols. I also do Webster's Technique, and so I always like to kind of combine the two when I'm treating someone with activator for pregnancy that may not necessarily like the cracking or the popping or anything along those lines. Activator technique always involves a lot of leg checks, and so what we like to do is kind of check and see how the legs are uneven when we're doing this. And we also check to see how the hips, how when she goes up, she wants to pull on her left side a little bit and canter the hips. And so that just tells me where to go and what to do. Then we kind of come back and we check the leg length at the bottom as well as we check the leg length at the top. And you can kind of see that corrected the issue. And that's what we want to do. Then you take your right hand and you're placing the small of your back, please. Good. Put it back down. And that just kind of pulls on a set of different muscles and kind of helps us check a few things. Each of these moves that I'm going to have her do checks a specific different level. Left hand and small back, please. Good. Put it back down. And so if everything looks normal, then we don't change anything. You know, if it checks even down there and even when I bend, then we don't do any adjustments. It's when it gets off just a little bit that's when we do the adjustment. And so you can see that she's level afterwards, and that's what we're trying to do. So right hand behind the head for me, please. Nope, behind the head. Okay. All right, put it back down. And if someone does that, that's okay, because the truth is, if you've already cleared that area, it shouldn't pull anything off. And now that you can see, she's actually a little bit longer on that left side, whereas when she originally started, she was shorter. And that just kind of tells me more what's going on. And you have to check the length down low as well as the length up high. You okay? Good. And now we show even, which is quite interesting and intriguing. Left hand behind the head. If I can speak, put it back down, please. Thank you. I think the hardest part of that is probably understanding me with the mask on. So again, we want to go there. And that's not uncommon to see it short on one side and the lower, and then go long on the other side. And that usually has to do with the way the hips and the back correlate. And that's all I have to say is that it does kind of change. So if you're going to have high on the left to start, you might have higher on the right where it's kind of compensating up above, if that makes any sense. Okay, and if you can see, it didn't quite clear. The left side is just a little bit higher than the right. So what we want to do is we want to do that again. It wasn't quite enough. And that's okay. That's why you always recheck it after each individual one. And so it's actually pulling. All right, left hand behind the head again for me. Good, put it back down. And so I may have wobbled you a little bit, but this should be the last time that we have to. And it has to do with everything of how it's off right or off left or anything else. Can you shrug your right shoulder? Good. Put it back down. Now some people do activator, but they don't shrug the left shoulder. Good. Put it back down. And they may not do all of these checks, and that's okay. But the true activator protocols techniques is designed for all of this. You okay? Good. We're off a little bit, but that's okay. All right, shrug that left shoulder again. Good, put it back down. You seem to be all left-sided today, and that's okay. Sometimes that's the way people are. You know, you may hold your other kids on your left hip, and that's going to tend to throw the left side off more. Sometimes it's more even, sometimes it's not, you know. Tuck your chin to your chest for me if you don't mind. Good, put it back down. Looks good. And then what you're going to do is lift over your right shoulder. Good, put it down. And so you can see it off here. But what I want you to do is actually bring the camera here so that this is probably the best one that you can see it's off here too. Sometimes it's longer here and shorter up top, and sometimes it's different, you know, like that's just the way that it is. Sometimes it'll show long on the same side, low and top. Sometimes it'll show long or short and vice versa up top. That just correlates to how the muscles coordinate and pull on the spine and pull things out of alignment. And then so now we come back and we're practically even in both spots. So I'm just going to do just a touch more. And it's okay if you have to do it more than once. I always jokingly say it's the opposite of cutting hair. I can always put more on, I can't take more off. Look over your left shoulder. Good, put it back down. But, good. All right. Look straight up in front of you. Good, put it back down. Good. All right, so I'm going to do a couple little checks on our hips. We're going to basically kind of push here and see how it kind of throws things out, how our body will respond to it. And did you say something?
Isn't interesting? Sorry.
It's all right. No, I totally. You're welcome to say as many comments as you like. You were kind enough to volunteer when I asked you. I was going to jokingly say voluntold, but
Yeah, voluntold. It's okay. I've been voluntold a lot.
when I asked you if you didn't mind doing the video, you were kind enough to say yes.
Yeah.
And so
I like learning. This is great.
yeah. Off just again a little on the left side. At this point, I'm going to jokingly say nothing too surprising. All right, let me have you just do one more right here. We're going to reset, and then we're going to roll you over to your back, okay? All right, and you can see that she's showing level on all of that. I don't know if I would, is that too fast? You can see she's level now, and that's what we're wanting. You can roll over to your back. I'm right here on your side if you need a hand.
Thank you. Then she fell off the table.
Please don't.
That would probably get a whole lot of YouTube views, but for totally other reasons. So what I'm going to do now is I'm going to just check the belly and baby positioning and everything. Is that okay?
That's great.
Good. You kind of already nodded your head as well. I went in and didn't quite wait for you to say yes. But, and then we kind of try to make sure that the round ligaments and everything are nice and loose. That it all feels like it's going to move fine. And the baby's doing great. Healthy, correct? All those fun things, correct? Okay. This is your fifth pregnancy, not your first. So your body's kind of, I jokingly say, used to it at this point.
Sure.
All right, I'm going to push on 4 spots on the front of the pelvis.
Okay.
If you can tell me if any of them are tender, that'd be great.
Okay, great.
1, 2, 3, and 4. I know 2 was.
Yeah.
Was 3 a little bit
Yes.
as well, but 1 and 4 were okay, right?
Yeah.
Okay. All right, so we're going to take this activator and put it right on the front. You okay?
Yes, it's great.
I'm not gonna lie, this is not the most comfortable thing.
That's
that I
okay.
do,
Whatever
right?
makes us feel better. This is good.
But when I come back afterwards, not nearly as tender, right?
Yeah, yeah.
Okay, and that's what it's supposed to do.
Yeah.
I also like to check the legs and the front. They should be pretty even, and they are stretching out. And we KT tape your low back and everything so that your back stays better.
That's
And I think
really
you said that it helps quite a bit.
It really has a lot. Yes, I felt like it does.
Did you tell me you went to the beach and you forgot the KT tape was on there or something?
If you guys want to see the tan lines, you can see them. They're still there. I did a number on myself.
Okay. All right, I'm just going to work here. If you want to put your hand down here to kind of block things, that's totally fine. I don't want you to feel uncomfortable with where my hands are working the adductors, because the adductors totally compensate for the pelvic floor, and they hurt and they're tender. I can see it in your face. You can hear the way that she breathes. I was going to tease and say it's not quite Lamaze breathing.
No, she's working on that. She's practicing.
All right, push up. Hold it there for 5, 4, 3, 2, and 1. Relax. During the course of many years, I've been a chiropractor for over 11 years. I have treated almost 6,000 different pregnant women.
Wow. And we're grateful.
Did you say we're grateful?
And we're grateful. It's good to
hug,
know.
Only teasing. You alright?
Yes, it's just.
Okay. And it's just uncomfortable.
Yep. Yep.
Like a sore muscle if somebody were to get in on a knot in your neck or whatnot.
Yes.
It's totally how it is because you have extra weight from the baby on the pelvic floor, pushing you up. You're exercising and doing all that stuff again, and that's wonderful. And I'm not against running. I'm not against exercising or any of that stuff while you're pregnant.
Yeah.
All I'm trying to say is that it does put extra pressure on your pelvic floor.
Yes.
We're gonna just kind of pull on this leg a little bit, if that's okay, right? Good, good. All right, I'm gonna stand you up.
Okay, sounds good.
Stand up and around, tell me how you feel.
Ready to run.
Ready to run? You were talking about the KT tape that was up here because originally you had neck pain and stuff, and that's completely resolved.
Yeah, that's really helpful. That really helps. Yeah.
Okay.
Yeah.
Good. If you don't mind demonstrating that for us. And this is perfectly easy to do as well as helpful to do while you're pregnant. It helps stretches the pelvic floor. You can push your elbows out, it kind of stretches a little bit. You want to get your butt as close to your ankles as possible. This isn't exactly super easy in dress pants, and then you want to push out is what you want to feel, and then that feels a nice stretch in there because the pelvic floor does need to be stretched. It needs to be contracted as well as stretched, just like any other muscle. But there's not a lot of things that we do that stretch it. Then we're just going to do a simple little groin stretch because as you saw in there, we were stretching, working on your groin. It's rather tight, a tight muscle and tender muscle. You want to do just a simple groin stretch. So just face square feet to me and just kind of take your hips like you're almost putting a baby on it and you feel that stretch down the center, right? Okay, and then from there, what we're going to do, we always like to do both sides, is we're going to simply stand up. We're going to move into a warrior. So it's like a warrior 2, but a little bit different. Yep, just like that. You're going to turn your hips and keep that chest up. And we're going to lunge forward. And you feel a nice stretch through the psoas. So you can lunge forward a little bit. You feel that stretch there, correct?
I do.
Okay, good. And stand up and try the other side. Meaning just kind of do it to the other direction and all. Okay, and again, you feel it there. Excellent stretch to do because psoas does get tight and you can't go in and do massage. Usually, sometimes when you're not pregnant, you can kind of come in from the front and do a little bit of massage on it. Can't do that right now.
Sure.
Most exercises I'm okay with, light impact depending on the activity level before pregnancy. Running's okay. Squats are great if you don't mind. We'll just do like to show that you have plenty of mobility to do a squat. Right, perfectly good. The one thing that I usually try not to tell people not to do too much are jumping exercises, such as jumping on a trampoline. I think that you said your boys like you to jump on a trampoline.
I do like to go on the trampoline with them, so I just go around like this.
which is fine because the more that you jump up and down, the more that it really attacks that pelvic floor.
Yes, I don't. Yes.
And you might have incidences of other things or
Yes.
whatever else happen during that time.
Yes.
If you'd like to see more stretches or exercises that we can do, we can post other videos about that, but that's all we're going to do for today. Thank you.